Don't make any test. The catatonia is not the test you make anyhow. You make your test in the order. Test 1, 2, 3, and 4. The first test is anesthesia. Second test is big muscle, like an arm or a leg. Second test is the eyes, the small muscle. And the next test is the catatonia. Better do front and back if they're all your patients, Doc.
No, I didn't say that.
Let them go all the way down to the basement. Denise, can you get to your patient? Huh? Can't find him. No. All right, now, gentlemen, once you get the state, once you reproduce the state, give them a chance to get all the way down there before you make any tests. Good question to ask is what floor you're on to see if they can make their lips move. So if they can't make their lips move, you know that they're down to the place where they're ready for tests. Remember, the first test, do you never give a suggestion for the anesthesia? Because if you have to give a suggestion for the anesthesia, you haven't got the coma state. And believe me, it's very important that anesthesia arrive by itself without suggestion from you. If you don't, you've really got deep somnambulism. There's all the difference in the world between deep somnambulism and a coma. That's Ask what floor they're at. I want you to make the test. Yeah, make the test in the same order that I did. First the anesthesia. See if they can tell you what floor they're at before you make any tests. Yeah.
How long should it take?
It should take about, well, by the Q technique, it shouldn't take you over about 30 seconds for them to get the coma again. Oh, but I have to take the long way around because I had to condition 45 at once. But generally, you can condition, play the record, and within 3 or 4 minutes after you play the record, you generally got the coma. Some men take longer, depending on how many instructions they want to add, but I can produce the coma in about 2 minutes past some ambulance. Doctor, she's the one who didn't get it, so let her go down a few more floors. No suggestion for anesthesia must ever be given if you're going to do deliveries in the coma state. The anesthesia must be induced by nature. When they relax every muscle, the anesthesia automatically occurs. If you told these girls how you test them, they'd be absolutely astounded because they wouldn't realize how anesthetized they were. Have you got a cramp, doctor?
I've already tested.
Oh, you've already tested. You got it up. All right. And don't touch their shoulders when you bring them out of it, because that's the cue to put them in, so don't confuse the two cues.
Why am I for you?
Yeah, if you made the tests. But you know that you've got to make the four for the 4 test, doctor. The big muscles after the. That's right. And but 1, 2, 3, 4 in that order. Did you make your tests all right? Good. Made all of them? Good.
This yours?
No, you don't make any suggestions, doctor. Once you get the scenario from the record, which you can, then to carry him right down to the coma with no suggestions further than when you saw me again. First, when you first gave the hypnosis, of course. No, not the first time, doctor. Not the first time. Not the first time I asked him to open their eyes. Whose patient is this one on the end here?
There's another one on this end.
Huh?
It's Dr. Peterson. She's got it today.
Oh. I'll route it. So, you can come up with like those eyes and tell the doctor wants to work with That's all right. I've only did that because I want to take her off the shoulder, because she had the state beautifully too. So many of them. You've seen an example of wonderful conditioning. I would say that of this group, and I think there are 47, am I right, in my count? Because I didn't count them since we added a few, and I think at that time we had 44 or 45. But of this group, there were only 3 who did not get the state. You've got to go deeper. There's fear in there someplace, wasn't there? Oh, yes, there was something kept you from it. And there was a fear over here that kept you from getting it, wasn't there? Sure, you tell your fear to the doctor, and he'll be able to, or she'll be, I don't know who the doctor is, but she'll be able to. Now, you let a little fear get in there after you had the state. You had it and lost it. Did you know that? So you tell your doctor what that fear is that made you snap out of it.
One going back.
Well, yeah? Well, there was something on your mind. I want you to tell me what thought was on your mind. It could be even the gas bill or something, that's seemingly away from it is bad. But it is concerned with it. I want you to tell me the thought that flashed through your mind that spoiled that wonderful state that you had, because you had this almost as cheap as the lady on the end there. And in fact, I was going to work with you first. Did you know that? That's how well you had it. And so then you lost it. Now the other one who didn't have it, who was the other one who didn't have it back there, Pauline?
I beg your pardon?
This lady, was it this lady?
This lady is Dr. Leopold's patient. What about that one?
Who was the one who didn't get it?
Dr. Leopold's patient.
Oh, you got it. You got it.
For me, but not for the doctor at all.
Oh. And who didn't? You didn't get it from the doctor just now. She didn't go. She didn't take the cue. What was on her mind? Was there a fear in there or something? Oh, I see. All right. Are we all through with our tests now, or are there still? All right. Go ahead. Go ahead.
I think in this case,
You don't even have to test the one on the end. She's so perfect, but I'd gamble on her.
one on the end actually got in sleep.
Oh, no, there's no such thing, Doc. There's no such thing. She got into a very lovely state, but she wasn't asleep. Ask her. Were you asleep at any time? You just know that you were very relaxed. But you didn't feel asleep, did you? That's right. That's right. But
Dave, ask her how much time elapsed, will you?
How much time elapsed?
How much time went by? 5 minutes.
5 minutes, yeah, well. But you see, time distortion occurs in hypnosis, so Well, that's all. They went back by the doctor's orders and around testing them yet. Not going back into it. It's just a lovely state. It's worth practicing. I wouldn't care how many have went back into it, so long as they realize that when they're supposed to come out of it, they're supposed to come out of it. That's all. But those girls have had nice practice, and so if they want some more practice, they can practice. How do you like it, though, ladies? Is that fun? Huh? Did you like it? Answer out loud, will you, please? Very much, is that right? So you see, it isn't a state that you have to worry about. And all those bugaboos, all those things that you've heard about this thing called hypnosis are all just lies told by people who know nothing about hypnosis. The man who knows about hypnosis doesn't speak against it. It's the man who thinks he knows hypnosis who speaks against it. But the man who really knows hypnosis never talks against hypnosis. Hypnosis was not made possible by God except that it be used when you need it. And here's something that you need at time of delivery. And so you're going to have this in addition to everything else available to you, so you don't have to worry about a thing. And if at any time any fears or anything like that creep into you, tell your doctor what they are. If anything's on your mind, you tell the doctor what that thought is. Now, we had an incident right tonight. I tell you truthfully, she had such a beautiful state that I even told her personally, I was going to work with her as the first patient instead of working with you as the first one. And because she was just in as good a state as you were in. The lady on the end, on the second row. But a fear came in there by the time I got to her and broke the state. Now, she says that she didn't have a fear, but there was a thought that came in and broke the state, and I'd like her doctor to know what the thought is. Now, I want you to know something. I am awfully disappointed with some of you, and I'm talking now about old students, that you couldn't see that that fear is the only enemy that hypnosis has. And if you, at the time that you wanted this state, weren't getting, why didn't you ask these people? What's on your mind? What's keeping you from getting the state? Now, suppose one of them had to go to the bathroom now. You suppose you could get the state? Of course not. We had an incident like that occur last night. Here she was, beautifully brought out of it. Now the doctor puts his hand on her shoulder. She says, I can't do it. I can't do it. So my wife happened to be near her there and says, what do you mean you can't do it? And she says, well, I can't do it. I just couldn't do it. I could never do it again. And she says, is there anything on your mind? She says, yeah. What is it? My wife says, what is it? I've got to go to the bathroom. So the bathroom. So she went to the bathroom and came back and got the state. Came back and got the state instantaneously. You're going to have a lovely experience with this lady, doctor. All right, you can all stop practicing now. Come up a flight and open your eyes. Come up a flight and open your eyes. Remember, the doctor won't let you have the state if you don't follow the orders, but you must open your eyes when he tells you to. So come up a flight to where you can open your eyes. Remember, you can practice this at home. You can practice this at home. And remember, the one sure thing that will always bring them out of the state is tell them that if you don't open your eyes when I tell you, I won't let you have this state anymore. And then they'll open their eyes. They'll open their eyes instantaneously. Now, ladies, you don't have to worry now about anything except be sure to tell your doctors anything that is on your mind. Because there is no reason at all why 47 women out of 47 can't have an absolutely painless delivery. Now remember, even the 3 who did not get the coma state had somnambulism. So they don't have to worry either. And their doctors will take them down to the coma state. When you get hold of this relaxation record, you practice at home, you'll be able to reach it the same as anybody else. Remember what I've told you. If your doctor doesn't think to ask you. For instance, let me tell you the type of thing that can keep you from getting the state. The nurse will come in and say, I told the doctor that you're here, Now you're at the hospital. I told the doctor that you're here, and he says he'll be over presently. Oh, that word presently can keep a woman from getting the stake. Is her doctor going to be there on time? No, you doctors never use the word presently to a nurse. Tell your nurse when she informs you, when the hospital calls you to tell you that your patient has arrived, the thing you say is, tell my patient I will be over there instantly. Then you remove the fear that you're not going to get there in time. But don't use the word presently. Don't use any semantics which makes the patient feel, is my doctor going to be here on time? Oh boy, is my doctor going to be here on time? That can keep patient after patient from entering the state. Suppose there's such a thing as you being in a clinic where 3 or 2 or 3 or 4 or 5 or 10 obstetricians are together in doing these deliveries. And one person prepares them and another person delivers them and so on. Make sure that the patient understands that, and make sure that the patient understands that at the time the doctor who is assigned to her delivery knows her case history from beginning to end and can handle them. You've got to get that thought over to the patient. Otherwise, she's going to say, where's the doctor I've been seeing when I came over the clinic? And things like that. And you've got to explain those things to the patients. In other words, this is not an out-of-this-world state. They are keenly conscious, keenly aware. Treat them as people, and you'll find that they'll respond beautifully. Ladies, I am delighted with the way you did tonight, and I think many of you are delighted with the way you did. You should all be delighted with the way you did. And those who missed, remember, the only thing that kept you from getting the state were some hidden fears. You had somnambulism? You had somnambulism, is that right? You made the numbers disappear, is that right? I'm talking about the lady in the third row. Sure. You made the numbers disappear? Did you make the numbers disappear? Well, when I lifted your hand and they dropped, did they drop? Did they go? If they were still there, you didn't have it. It's as simple as that. The others made the numbers disappear, and if you didn't make the numbers disappear, you didn't have it. Well, then you didn't have it. But everybody back there and everybody up here made the numbers disappear. You must make them disappear. You get the artificial state of somnambulism if you don't make the numbers disappear. And the artificial state is no good. Send those numbers away, dispel them. That record that you heard, the woman to whom that delivery talk was made, after this conditioning talk, delivered 7 minutes after she reached the hospital. So I want you to know that many of you can expect to have your baby quite rapidly. Now, why is that? Because it is my contention, and I believe that you will find it scientifically correct, that when a woman fights the contractions, she feels them terribly. But when you're in this relaxed state, you're working with the contractions. Therefore, each contraction carries you along so much further. We've had this experience happen, I believe it was in either Milwaukee or Chicago. It was one of those two towns, anyhow, where the doctor examines the patient and finds her 3 centimeters dilated. And says to the nurse, well, I've got plenty of time yet. I'll go down and have a cup of coffee. Call me when you think she's ready. And he goes down and he orders the coffee in the cafe because it was in the middle of the night. No, every place else was closed. And he was talking to the waitress there as she was pouring his coffee and so on. And he hadn't taken more than a sip or two of it when the telephone rang. The doctor, your patient is ready, your patient is ready. He says, that's impossible. She was just 3 centimeters dilated 3-4 minutes ago. Now, you can't tell me that she is completely dilated at this point. Doctor, I tell you, she is fully dilated. You'd better come up here. She's had 2 contractions and has carried her all the way. Now, he went up there and he told in class, he says, I scarcely made it in time. That's how fast you have your deliveries when you do not fight the contractions. So I'm giving you sound scientific advice when I say relax every muscle in your body and practice relaxation. I just wish I had a relaxation record to give every lady here. I haven't got enough. 2 doctors had already ordered some, and I didn't know about that. So I brought them in, figuring that we would have enough. I haven't. So I just can't do anything about it at this point. But you should practice relaxation at home. Practice just what you did tonight. And you'll all do all right. Now, ladies, we're going to show this picture, but I've got to go on with the class. Would you all like to vanish, maybe, and go out the washroom and things like that? And I'll go ahead with the class and then come back. And if you want to, we'll let you see the picture. Now, the picture was made at St. Francis Hospital in Milwaukee, Wisconsin. And it was made under the supervision of the Felician Sisters of the Catholic Church. It was done by men who teach at Marquette University. And they're my students. And it's a rather wonderful picture, except this, that you must know that in delivery, some of you who are primiparous, that means going to have their first baby, don't realize that the baby doesn't emerge all washed and cleaned and everything else. The baby emerges as nature intended it to emerge, and the nurse or whoever's there washes the baby, and then you see your baby beautifully washed and so on. So if you are a little, you don't want to see the sight of blood on a little baby just being born, or if there's any thought like that on your mind, then perhaps it would be wise for you not to see the picture. But I can assure you that all babies are born the same way. They don't come out already bathed, you know. They have to be bathed. But in case there's nothing in the picture that is objectionable that you can't see. And the doctors enjoy the picture, and if you'd like to see it, you're cordially invited to see it. But now I'm going to say class dismissed for those of you who have been conditioned, and you can go outside and get comfortable and then come on back while I talk to the doctor, sir, and give them some further instruction. Now, friends, there are certain things I want to explain to you before we go into the lesson part of this, and that is the material that you are going to take home with you tonight. First off, you're going to take home a very thorough outline on the coma. I want you to read it, and I want you to study it. These things are not given to you to take home and put in your desk drawer and then not look at again. There is a very nice set of instructions on how to achieve the coma, and it answers a lot of questions which many of you may have already. Now, in addition to the coma outline, you are going to get, in addition to the hypnotic coma outline, is Section 1, Part 1 of hypnoanalysis. For it is at the next session, Session 7, that we go into hypnoanalysis. I want you to have read that outline before you get here. Then you will understand, perhaps, more about the session before you go into it. You know that I gave you that set of hypnoanalysis records to hear because I thought that every doctor should become attuned to thinking in terms of hypnoanalysis. Now, many of you don't want to use hypnoanalysis, I know that. And yet many of you do. And those of you who do seem to get some remarkable success out of your work with hypnoanalysis. I'm not asking every doctor to use hypnoanalysis. There are such practices as might proscribe hypnoanalysis. But I do want you to listen to the records, and I think every one of you have by this time. I also want you to realize that if you hadn't had Session 5 2 weeks ago, you wouldn't understand how we achieve depth necessary for probing to find out the cause of neurotic ailments. Compounding is the entire answer. You might also see that in tonight's obtaining of the coma, that it is all done by compounding. Without compounding, hypnosis is valueless to a doctor. I can tell you that. I think it can only be used for little things, none of the important things. Delighted me when I saw that the AP wires had taken Dr. Tintero's statement at the meeting of the surgeons, I believe it is in Denver, where he's talking to them and talking about the value of hypnosis in intractable pain and so on. But when he talks about hypnosis, he's talking about the value of compounding, and nowhere else in the world is compounding understood nor taught except in this classroom. A doctor could never understand what makes compounding work unless it is explained to him in the light of what the stage operator sees. Now, this group of people that are here tonight pleases me immensely. I tell you something, at our last session, when I asked for a show of hands of how many people are going to bring people, I was so bitterly disappointed. I thought to myself, last year we had 37 people here for conditioning. Along is going to come session 6 here in Wichita again, and maybe we'll have 10, 15 people to condition. But I want to thank you, and thank you very, very much for bringing so many of your patients tonight. It shows the faith and trust you have in this course, and it shows the faith and trust you have in the techniques which I teach. And it also shows you that all of those women want what you have to offer that you get from this course. So put it to use. I hope that my talk tonight about fear lets you see what made possible the failures that some of you had with a few of those 37 that were conditioned. If you had only asked the patient, what's on your mind? What are you thinking about? You would be surprised what you will find will destroy the state. Fears, as I have told you, are the big thing, but it doesn't matter what the fears are. If you don't get the state after it has once been cued like we cued it tonight, then, gentlemen, something is on the patient's mind. I want you to ask that patient. If you put the hand on the shoulder and that patient doesn't go right down to coma, you stop right there and say, now, wait a minute. That tells me that something is on your mind. I want to know what's on your mind, what's keeping you, what's holding you back. Well, I don't know, doctor, but I was just thinking about my sister, and so, and out comes something that you would think had no connection, and yet it has all the connection in the world. Like the doctor last night would never have thought of asking that patient, do you have to go to the bathroom? It would take a woman standing beside her who had been pregnant herself and knew what might be the situation to discover that particular thing. Because I can almost imagine, can't you, some woman saying, well, I'll never be able to get that state again. I just couldn't get it. Now, would she say what was really on her mind? I got to go to the bathroom so bad that I couldn't even try right now. But those are the things you must watch for. Those of you who have had perfect deliveries, and I know most of you have had perfect deliveries in this state, must realize that when you don't have complete success, there's a reason. And as a teacher, I am terribly disappointed when I have done this work, conditioned them, and then you don't have an absolutely painless delivery. Because I know that something has been done wrong to keep that patient from having a painless delivery. And the thing that has been done wrong is the fact that you haven't asked the questions. The patient won't mind your question. If you say to her, no, wait a minute, you're not getting the state. I just touched your shoulder and you didn't go down to that basement of relaxation. Now, there's a reason why that didn't happen. Then she'll probably say, I can't think of any reason. I don't know of any reason. Oh, but there is a reason, and you stick with it until you've got the reason. Once you've got the reason out, they'll just go right down to the coma instantaneously, and they'll have their baby painlessly. But remember that. And I want you ladies who are conditioned tonight to remember that. Don't keep anything back from your doctor. And we'll have 47 out of 47 who will have painless deliveries. 3 might have them in the somnambulistic state, I'm not sure. But all 44 of the rest of you should have your delivery in the coma state, and those 3 who only got to somnambulism should be able to reach the coma state. I'm sorry if I seem awfully, well, what would you say, driving this point home hard. But how do you think I feel when I know that every one of these people could have a painless delivery, and then I get a report, some doctor says, well, you know that woman who did so beautifully on the so-and-so? Well, came time, I touched her shoulder and nothing happened. Well, did you ask her why? Well, no, I just used the ordinary techniques. Oh, no, 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 there's a reason why. And then you will say to the doctor, if anything like that ever happens again, you ask her what the reason is. Then you'll see that doctor next time, he says, now I got the answer. You see, her sister-in-law was supposed to take care of her baby, and she hadn't arrived at the time that she left for the hospital, and she was worried that she was going to have her baby so fast that she wouldn't have a chance to talk to her sister on the telephone, and so on.